My name is Shannon Whiteman. I am going to co-chair here with my partner in crime, Kendra. And we're going to go ahead and start off this morning's talk with the CF Foundation Education Committee updates. This is my third and final year, as well as Kendra's with the committee, so you guys don't have to deal with me much longer. But it has been a joy. So our CF committee, my disclosures, I have none. I am from Pittsburgh, Pennsylvania, working with the adult CF program, and I am a nurse. Kendra is, she is an independent contractor and patient trainer for Respitech, sorry. So the adult, excuse me, I apologize, let me gather myself. So the education committee we are an adult and pediatric specialist group, multidisciplinary, including physicians as well as nurses, dietitians, social workers, and even patients as well as genetic counselors. And we serve a 3-year term. And what they request is experience with CF and or creating education and reviewing materials and developmenting education material. We share all of our education material via the MyCFF exchange and listservs. So if you guys are not familiar, if you go to mycff.org, there's a tab, and I'll show it here in a minute, where you can order all of this free education material. It can be shipped to your center, and or you can download it and hand it out to patients and or colleagues. But this is who we are. This is last year's picture of our committee. And you guys don't need to see everybody's name there, but that's who we are. So what we do is we ensure the quality education material are available to patients and families, as well as CF centers. We review all of the education material that is brought to us for accuracy, acceptability across centers, and appropriate reading levels. We do identify areas of greatest need, and then we prioritize those reviews before the CF Foundation stamps them and says, yes, this is a good resource. But we do solicit authors for any education material. So if you have something, please bring it to the committee. We can review it, and then we can actually put it out on listservs if it's valid, and we'll review it and help you get it to a good reading level as well as for patients. And then they can also put it into other languages like Spanish. So things that we have done in the last year that you can already order is Introduction to CF for Families, 7th edition. So this is the new one. We did try and add things for especially the new adult diagnosis, and the Spanish version is coming, but you can order this at no cost on mycff.org. We also did the birth control guide for people with CF, both English and Spanish, family planning for men with adult CF handout, and then there is a great CF liver ultrasound discussion for clinicians. It gives you points for the clinicians on how to discuss that need for the liver testing and the ultrasounds for families. It gives good points. We've also done CF Rise updates to the CF liver disease and CF-related diabetes, also available in Spanish on cfrise.com. Bright Beginnings is also a great new resource for empowering parents. It's practical information and tips for parents with newly diagnosed child with CF. We did Health Literacy Friendly Resource Development Guide, so it actually gives us a guide, as well as everybody in the room, on how to develop more friendly resources that are available, so to help you create new guides. We've also updated the CF Education Resource Guide in 2025. So here we are. If you're not sure where to find these resources, it is cff.org in the resource library. You can go through, there is a nice little thing you can click, and you can click all of them. I personally did it when I started several years ago, and I got this huge box with all of these resources. Some of them I found helpful, others I haven't, but I will say, at least I am an adult provider. We hand it out to the big book because people will come and they're like, I don't know. You give them a good resource that has what is pertinent and not looking up something on Google. It's very helpful, and you can have that within your clinic. So those are hard copies, but then you can also contact resources at cff.org for help finding anything, or you can ask one of us because I'm pretty familiar with it at this point. So this is actually what the tiles look like, and you can go to the order forms, and then there's the education materials order form. And then you can go through and you can see all of the ones that you can print out and and they will deliver to you already bound, which is really nice. And there's also videos and stuff, depending on what you're looking for exercises and dietary stuff. So what you can do to help us, you can submit educational abstracts for NACFC. As a committee chair, I did sit and I got to read all of them, so those are wonderful. You can notify the education committee about any materials that are out of date, which we have been working on trying to get through because some of them, especially some of the videos, are from the 80s and it's kind of funny. But you can also distribute all of this information to the CF community to make sure that we're getting good resources that are out there, and they're true resources and not something that you find on Google. And also you can submit future education material to resources at cff.org. And that's all I have. Okay, next we're actually going to have Jasmine from Lubbock, Texas. Let's see if I can get your files to open. There we go. And Jasmine is going to talk about the LEAPP program and fellowship.
Thank you, Jess. Yeah. I gotta adjust this so you guys can hear me. Is that good? Okay. So my name is Jasmine. I started my journey in cystic fibrosis about 10 years ago in 2015. I joined our CF care team as the CF clinical nurse, and I was able to participate in the CF program coordinator mentorship program at that time. A few years later, our program continued to grow. We started getting more patients, and it was very clear that our CF director was not able to maintain all of the patients on her own. So at that time, we're an affiliate CF center, and we had a site visit, and they had asked, would you be willing to go back to school to obtain your nurse practitioner? And so at that time I did. I went back and I completed my postmaster's certification as a pediatric nurse practitioner. And I completed towards the end of 2019, and then we all kind of know what happened the year after that. Shortly later in 2021, the CF Foundation offered a program for APPs, and I was very thrilled and excited because I was transitioning from the CF clinic nurse to a provider, so this program couldn't have came at a better time, and that was the LEAPP Fellowship Program for Advanced Practice Providers. And this fellowship not only gave me the confidence as a new APP provider, but it also provided me an leadership experience. I have no disclosures at this time. I'm going to describe the structure, goals, and outcomes of the LEAPP program and its relevance to professional development in cystic fibrosis care. So let's take a deeper dive into leadership and education for advanced practice providers, also known as LEAPP. This is a 2-year postgraduate competency-based fellowship for nurse practitioners and physician assistants who are new to CF care, with a goal to produce expert clinical providers with skills in leadership and quality improvement initiatives, and to generate opportunities for professional growth and organizational enculturation throughout the CF community. And this is very true because you'll see many of the fellows that did graduate from this program, they're now speakers in NACFC, and one of them is actually an instructor in the program for the quality improvement. She's a faculty, so that is very true for our class. The LEAPP curriculum had 4 components with practice-based learning, leadership, clinical experience, and we all had to complete a quality improvement project. With our practice-based learning, this was asynchronous and synchronous. We worked through the University of Minnesota through Canvas and did online readings, as well as every other week we came together via Zoom with clinical experts. There was about 13 fellows, and we were from all over the United States, probably the most southern being San Antonio, Texas, and the most northern coming from Buffalo, New York. And so we were united every couple of weeks via Zoom. And our course content included genetics, diagnosis of CF, and care across the lifespan from infants to adults. Advanced topics included lung transplantation and palliative care. At each of our sessions, depending on what the topic at the time was, we had clinical case presentations that we discussed with the interdisciplinary experts that were present at the time. And this really allowed us to increase our confidence and create these professional connections. When we would meet with different geneticists, or any other specialty, we had ENT, we had gastroenterology, they were able to say, hey, you guys are doing the right thing with your patients. If you ever have any questions, please feel free to reach out to us. And so creating that networking, not only with our fellows, but with experts outside within the CF community was invaluable. And then our clinical experience, this was done at our home CF Centered. We were mentored. Clinical practice was designed to facilitate our progress as CF providers. And my CF mentor for my clinical experience was my director, Dr. Canu. And she provided guidance with our case studies, leadership opportunities, and then partnered with me on my quality improvement project. So for 2 years that I participated in this fellowship, I saw all of our CF patients that came through during that time. That was all of the pediatric patients, all of the adult patients, anything that came in inpatient and outpatient. And so this really allowed me for 2 years to really get to see all of our patients from infant to adult. And then during this time, I began taking on my own CF patients to start my clinic. My quality improvement project, so I'm from Lubbock, Texas. Like I said, we're an affiliate CF center. This is Lubbock. And this area around here highlights our service area. I apologize, the picture is blurry. We serve a 300-mile radius. Up here is Albuquerque. That's the closest CF center to us. And then Dallas area. Those are about 5-hour drive away. So we serve a very rural area. And this is why we needed an additional CF provider. For our clinic, for our patients to be able to see a registered dietitian, they would have to have scheduled 2 separate visits. So they would have to schedule a visit to see us and then a visit to see the dietitian, because we are a small CF center and we do not have enough patients to have a dedicated dietitian. So my goal was to increase the access to care through a registered dietitian visit for CF patient and limit barriers, including travel time and cost, by utilizing telemedicine visits. So after this quality improvement project was completed and looking at our registry data, I noticed the patients that it was affecting the most was our younger patients. And I mean, we can imagine why. It's hard to travel with an infant 4.5 hours or a toddler. And so it was many of those families that were not coming to their visit. So after this project, we were able to obtain a registered dietitian for our center. And I wanted to highlight another fellow of mine. She wanted, after looking at her registry data, she wanted to improve colon cancer. So she collaborated with colon cancer screening. So she collaborated with the gastroenterology team, and this did improve the screening process, and it actually resulted in an early diagnosis and treatment of colon cancer in a CF patient. There's going to be a session tomorrow from 10:15 to 11:15 that talks about best abstracts in nursing. It's in room 420, and it's also going to highlight, I believe, the second cohort of LEAPP Fellows quality improvement projects. And leadership. So this was a really important component because I was coming in as a prior nurse. And in Texas, we are not a full practice authority state. Coming in as a nurse, I didn't realize the lack of representation that APPs had within my institution. We have a lot of nursing leadership, and so I felt as a nurse we were very well represented. However, transitioning into this APP role, I realized very quickly that we didn't have a lot of representation in my institution. There was no APP director. Even within my own department, we didn't have a lead nurse practitioner. And so it was really important for me throughout this program to learn that it's really key for us to pull up and have a seat at the table with these providers. And so when I came into my role as an APP, I didn't quite no longer fit with the nurses. I wasn't included in those meetings because I was no longer considered staffing, but I work in a school of medicine, so I was also not faculty because I was not a physician. And so I did realize that gap. And what this leadership curriculum did, it was designed to promote intentional career development, retention within the CF community, and job satisfaction. While it was patient-focused, fellows focused on, as our competency grew, our content shifted toward organization and system-focused leadership. I had the opportunity to work with Monica. She was from Boston Children's. She was the lead nurse practitioner, and we not only got to discuss best practices as a new APP, but we got to talk about her leadership role within her institution and how necessary that was for the institution that I worked in. And so through her mentorship, I was able to talk about the importance with our administrative staff for a lead APP within our department, and then as well as talking about the role of an APP director within our institution. So the leadership opportunities that I've had after LEAPP included becoming a speaker in NACFC. I think sitting in this conference 10 years ago, I don't think I ever would have saw myself having that opportunity to do that. I was very new to CF, to the conference, and that was an exciting opportunity that I got to do in 2023. We were able to talk to our administrative staff, and so we have an APP council now within our institution. And I have had opportunities to speak to our nurses, that Region 17 Texas School of Nursing Association. It's that service area that I showed you. That's about how big that region conference is. And I got to talk to those nurses about cystic fibrosis, whereas before maybe, they wouldn't have reached out, but they realized that, I did have this experience as a LEAPP fellow, and they usually invite a lot of physicians to speak at that, so it was nice to be included in that as well. After working with a lot of my fellows, there was a couple of them that had their doctorate, and I realized very quickly the gap in my experience versus theirs for research. So after the completion of the program, I did start my doctorate, and I completed that in May of 2025. And so that has really helped me moving forward. I'm now participating in research within our institution. And then my most recent opportunity was I am now a consultant for a mentorship curriculum because I have learned the importance of mentoring others, and this program will include nursing students, medical students, and pharmacy students. So post-fellowship, we were able to increase the number of patients at our center. We didn't have to turn patients down anymore. We did hire an RD for telemedicine support, and currently we're in the journey of from being an affiliate CF Center to now, within the next couple of years, being a standalone CF Center. And this is the group of fellows from 2023. I see one of them in the back. And I just really want to thank Cynthia George, Cindy Brady, and Dr. Dunitz here in front. These were our main clinical instructors. And then tomorrow, they will be talking more about the future of LEAPP in 2026. It will expand from the single program of what I just discussed in my experience to these programs here. They are still doing LEAPP for those who are new to CF, and they will release some more information on that 2026 for a start date of January 2027. If you are in these, if you do receive emails for nursing or for APPs, you should have seen an email for the LEAPP QI come up. For APPs beyond 3 years, they are calling for that right now. And then they will talk more about LEAPP Forward, and I'll show you that session here if anyone's interested in attending. That's tomorrow. And those are my references. I think overall, for what I've learned throughout the program is that it's really important as nurses and advanced practice providers that we could continue to seek out educational opportunities to improve our patient care, and also just to show our presence within our community and just within our institution. Any questions? Let me come off of this.
So next, we're going to have Stacy Mounts come up. She is from Ready Children's Hospital in San Diego, and she is going to discuss nursing mentorship.
Hi, good morning, everyone. Let me just hit here. Oh, distance. Is that good? A little bit closer. Here, okay. All right, so my name is Stacy Mount. I am the program coordinator for Rady Children's Hospital Cystic Fibrosis Center. I have no disclosures. So I have been a nurse for 18 years. I started nursing 18 years ago at Children's National Medical Center on a respiratory care unit, and I was working with cystic fibrosis patients as early as my new grad program. I started at Rady's 16 years ago and worked on our medical and pulmonary unit, working with, again, cystic fibrosis patients along with our other patient populations. And then I started in our cystic fibrosis clinic 8 years ago. My hire was actually with the intention of taking over for the current coordinator at the time prior to her retirement. After years of coming to this conference, I learned how lucky I truly was to have that mentorship alone, and having 2 to 3 years, the pandemic sort of cut it a little short, with her and learning from her as well. I've spoken with a lot of program coordinators that have been thrown into the role without any training, without anybody to guide them or tell them what the role entailed. So I was very lucky in that respect. Even still, my predecessor did recommend and encourage me to do the nurse mentorship program, which I completed in the following year of May 2018. And I have been the program coordinator since officially 2019, when she turned the role over fully to me. Okay, so I just wanted to show you the differences between the centers. This is my center, Rady Children's. We have roughly about 110 patients. That usually fluctuates a little bit up and down. We serve a pretty large radius in Southern California, and the closest center is about 80 miles away in any direction, obviously except west because there's no center in the Pacific Ocean. We only have 2 CF providers, and then we do have our specialty clinics with some GI providers and an endocrinologist. I did my mentorship in Utah at Intermountain Healthcare, Primary Children's Hospital in Salt Lake City, with the wonderful Sue Meals, who could not be here today. She sends her love. They have a larger center with a larger area that they serve. They have 4 CF providers, a much larger multidisciplinary team, and integrated specialty clinics as well with their GI and endo specialties. And so while our centers were very different, I did really get a good experience seeing what another center does. And so the reason that my program coordinator at the time encouraged me to do this was to get new ideas, to get fresh ideas, and to see what another center does. They matched us together through this program because they do have a wide area of service, not quite much larger than mine, but we do span and we do have patients that travel. And it was really nice to see what a larger center with different resources is able to provide. Okay, so let me go back. I forgot what my slide was. So through this mentorship, I saw how Sue ran her clinic, the different things that she did during her clinic to organize it, to organize her providers, and take away the important pieces of each patient's visit that day. I learned a lot of different things that they do. I learned about their parent advisory committee and how involved this center's parent advisory committee is. And through the years, I've been able to incorporate that or bring some of those ideas to my slightly smaller center. I haven't been able to incorporate each of them in the same manner. And as we all know, change takes time. But I think over time, I've been able to change the way that my center looks at how we provide care for our patients, how we do things from our pre-clinic huddle to our post-clinic huddle to how we involve our parent advisors, and some other little things such as like even a newborn welcome kit or a newborn welcome letter, things that are very small but have very large impacts. So not a whole lot to say, I guess, but I think my main point is if you haven't done the mentorship and because you had someone who trained you or you've been doing it for a little while and you think it's too late for you to do it, I really encourage you to reconsider because you can never really have too many mentors or cheerleaders. I definitely want to be standing here if it weren't for Sue. She encouraged me to speak today. She encouraged me to do my first speaking at NACFC 2 years ago. She also encouraged me to apply for the education committee, which I am now a part of and had my first meeting yesterday. And just like Jasmine, when I first came to NACFC 8 years ago, I was very impressed by all the nurses, all the speakers, everything that they have done, and did not think that was something that I would probably get to do or really have anything to say. And, it's been a really great opportunity to have Sue on my side, even from Utah, sending me emails, telling me how great I am, telling me to talk about all the great things I've done, even though I'm not very good at thinking about what those are. And it's always good to get a different perspective. We all know that working in a hospital, it's really hard to make change. It's really hard to get your leadership on board. Coming from larger hospital systems, CF might be a very small portion of what that hospital system does. And, you just have to take it one small step at a time and make small changes, small improvements, even if they don't seem big, even if they don't make a big splash and you don't necessarily come up and speak about them at NACFC or even your institution might not recognize them. They all make a difference to how your CF team works, collaborates, and provides care to your patients. So I think it's always a good opportunity to learn from others. And just like we always say, steal shamelessly. So it gives you that opportunity. That's it.
So next, we're actually going to have Franny Kyles. She is from Blue Path Health, and she is a patient with CF. Let's see. Here we go. Thank you, Franny.
Can everyone hear me okay? Okay. Good morning, everyone. I'm excited to be here today to speak about my own personal experience living with cystic fibrosis and also my experience with mentorship in that personal journey as well. And I have no disclosures to report for this presentation. So just a quick overview. First, I'm going to talk about my journey with CF from when I was born all the way up until today. And then I'll then highlight some mentorship experiences that I've had along the way, and finally talk about the benefits of those experiences and some recommendations for building upon and expanding those types of mentorship programs. So a little bit about me. I'm 27 years old, living with CF. I grew up in a suburb of San Francisco called Mill Valley, California, with my mom, my dad, and my older brother, who does not have CF, and they're pictured here. Oh, I think there's a laser, right? Maybe not. I just received my Master of Public Health degree from UCLA this past June, and I'm currently living back in the Bay Area, working at a small healthcare consulting company called Blue Path Health, where we work on projects to strengthen community health within the state of California. And in my free time, I enjoy hiking and running and singing and writing music. So I was born in 1998 and was diagnosed with CF at 2 months old with a sweat chloride test. I have the most common mutation, a 508del mutation, as well as an ultra-rare mutation, and for this reason, it didn't show up on a newborn screening, so it took 2 months before I was diagnosed. But when I was born, I experienced failure to thrive as a result of pancreatic insufficiency, which is why I ended up being diagnosed with CF. And so this is what I looked like before I was diagnosed and before I was on pancreatic enzymes, and then this is what I looked like after I was diagnosed and was on enzymes. And so as you can see, it was a night and day difference, and I was able to gain quite a bit of weight really fast, and my quality of life was substantially improved. So once I was diagnosed, I started receiving care and continue to receive care to this day at UCSF. I was lucky enough to have relatively mild symptoms during my childhood, but continued to experience pancreatic insufficiency and was treated for both Pseudomonas and staph periodically. My health started to decline a bit more when I reached middle school age. My lung infections increased. I had my first bronchoscopy because of those infections and continued to experience pancreatic insufficiency. And then moving into high school, those lung infections became even more frequent. And I also had a fungal infection, which led to periodic hemoptysis as well, and my first hospitalization. But overall, my health during my childhood was relatively mild compared to a lot of people with CF. And so being someone in the public health field, I just wanted to highlight some of the important factors for that I think have impacted my health throughout my life. So the first factors I wanted to highlight are the social determinants of health, which I'm sure many of you have heard of, but essentially are non-medical factors that impact someone's health, including socioeconomic status or housing status or something of that sort. And so for me, growing up in a wealthy area near San Francisco, I was privileged to have excellent access to high quality health care. I also had excellent social support and resources throughout my life growing up, as well as access to clean air, healthy food, and safe areas to exercise. And so for this, I think this was a fundamental part of why I was able to have a relatively stable health growing up. And it's also why it's so important that there's more research today about health equity in CF, because addressing these types of factors are incredibly important for reducing the health disparities that exist in CF outcomes today. In addition, I also was very adherent to treatments. I also exercised quite a bit, which I'll talk about more in a moment. I also love to sing, and I think that had a really positive impact on my respiratory health, which I'll also talk about in more detail later. And then I think it's likely that some genetic factors may have played a role. And I was always, very persistent, even when, times were a little bit more difficult. And then finally, as I'm sure all of you know, CF is just a very unpredictable disease, and I think that there's just quite a bit of luck that plays into how disease is going to progress. So as I just mentioned, I exercised quite a bit growing up. My main sport that I did was track and field. I started running track when I was 6 years old because my parents felt wanted me to participate in a sport that would help my CF and help keep my lungs clear. And so my older brother and I both started competing in track when we were really little, and also both competed all the way through college. So here are just some photos from throughout my life competing in track. So from when I was really little, doing the long jump in the left-hand corner, all the way through competing at Tufts University. And I still really love running and hiking to this day. And my dad and I even competed in a mountain run in Jackson Hole, Wyoming last year, which you can see down here. Yeah. And I think, sometimes it was really difficult to run track with CF, but I also think it was a really important part of how I was able to, stay as healthy as I possibly could. So the next part of my CF journey was college. So I attended Tufts University and majored in biology. Tufts University is in Boston. And when I was applying to college, I really wanted to, experience living somewhere new, but moving all the way across the country was a really huge change. And for that reason, I continued to receive care at UCSF as a way to have some continuity of care. But I also received care at Mass General Hospital so that I could have, easy access to care if I needed it while in college. In college, I also experienced frequent health infections and continued to experience more hemoptysis and had a resurgence of that fungal infection, which led to another hospitalization. And so juggling all of this on my own for the first time was really difficult, and I definitely struggled emotionally, especially when I first, for my freshman year, when I just adjusting to all those changes. And especially with trying to compete in track as well, since I've always been pretty competitive, and so I kind of held myself to a high standard in terms of how I wanted to do, but given my health, I really struggled to meet that. So that was just a difficult, adjustment for me. But nevertheless, I also had lots of experiences and opportunities to grow in college, and being able to take classes in biology inspired me to become more connected with the CF community as well as go into public health. And so that brings me to the first mentorship experience that I had. I didn't really have any mentorship experiences when I was during my childhood, but after my freshman year of college in the summer of 2017, I received the Elizabeth Nash Foundation Summer Research Award, where I got the opportunity to conduct summer research at a CF lab in the Children's Hospital Oakland Research Institute. And this was a really great opportunity just for me as a biology student to get experience working in a lab, but also it was a really personal experience to me. At this time, the CFTR modulators were available, but since I had an ultra-rare mutation, I did not currently have access to those. And the professor who I worked with understood the importance of testing those modulators on rare and ultra-rare mutations so that those people wouldn't be left behind as these medications continued to be introduced. And so I got the opportunity to work on that project with her. And so my project was called Personalized Medicine for Rare and Ultra-Rare Mutations in Cystic Fibrosis. And at the same time, since I also had CF and had a rare mutation, I got to have my cells tested with the CFTR modulators. And it actually turned out that I was a weak responder for ivacaftor, lumacaftor, and tezacaftor. And because of those findings, I actually was able to start on ivacaftor that summer. So it was an amazing experience, being able to work in a lab, but also for my own journey with CF as well. So the second mentorship experience that I was involved in 2018, the CF activist Claire Wineland sadly passed away, and I think that was something that was really sad and difficult for many people in the CF community, and I think it just made me want to get more involved in the CF community and follow in the footsteps and the impact that she made during her life. And so I reached out to my CF center at MGH and asked if there was any way I could be involved. And that actually turned into a part-time job helping some of the pulmonologists at MGH update and edit CF web content and make CF information more accessible and digestible for the public. And so this was, a very public health-oriented opportunity. It also allowed me to form more connections with the CF team at MGH, learn more about CF research, and also ended up turning into a summer internship. So this was a really great opportunity for a number of reasons, but also definitely had a major impact on my own career interests and my own career path. So the last part of my CF journey I wanted to highlight that brings us to today is my experience with the CFTR modulators. So as I said, I was able to start on ivacaftor in 2017 because of that research experience. And since I had an ultra rare mutation and was a weak responder, it didn't have a major impact on my health, but I definitely did experience some mild improvements in my respiratory symptoms. And then in 2018, I had the opportunity to start on the tezacaftor-ivacaftor combination when that became available. I definitely felt a bit stronger effects than I had on ivacaftor, but nothing crazy. But definitely did help me. Didn't help my health. And then finally, in December of 2019, I was able to start on the triple combination, and this had absolutely life-changing effects for me. My health completely stabilized. I had barely any more lung infections, barely even had congestion. It was just an incredible change. And my sweat chloride actually dropped more than 70 points, which was like insane. Yeah. And so in the last 5 years, I've been able to continue taking this medication, and I've continued to have very little congestion, very few lung infections, almost no hemoptysis, which was huge because that was something I really, really struggled with, especially in college. And still have some pancreatic insufficiency, but overall it's just been a life-changing experience. And it's enabled me to even reach new heights, literally. This past summer, I was able to participate in a trek to Machu Picchu, and we climbed up the Salcante Pass, which is at 15,000 feet elevation. And I don't think I would have been able to do that if I hadn't been able to be on the triple combination modulator. So the next mentorship program that I wanted to highlight that I'm a part of is called Singspire. So as I mentioned before, I've always loved to sing, and when I found out about this program, I was super excited because this program basically combines CF and singing by helping combat the symptoms of CF through the art of singing. It provides free voice lessons to people with CF of any singing level and age. And it's part of a larger nonprofit called Breathe Bravely, which was founded and run by a woman with CF named Ashley Blue Bonema, who is also an incredible musician. So I was able to start in Singspire in 2020 and have been participating in it ever since. All of the voice lessons are virtual also, since people with CF can't really sing together, unfortunately. But I was able to join in fall 2020, and it also just increased my confidence with singing, and I actually started performing in a musical duo and have been performing in different open mics and other like little gigs in the Bay Area. And this past month, I actually also had the opportunity to become a voice instructor in the program. So as of 2025, I take lessons in the program and also teach other people with CF voice lessons. So this program has quite a few different benefits, both physical and psychological benefits. Singing definitely has a positive impact on respiratory health, and one of the purposes of the program is to help people better understand their breathing and the breath support that's required for singing. And this also has a positive impact on PFTs. Also, in terms of psychological mental health benefits, just the joy of singing, no matter what level or age you are, has a positive impact on mental health. And this program also offers a lot of different opportunities for people with CF in the community to interact and bond, and not only bond over their shared experience with CF, but also over something that's not directly CF related, which I think is really impactful as well. And so I would love to see, this program expanded even more to reach even more people with CF. And then the last mentorship experience I wanted to highlight is my experience with the CF Peer Connect program. So this is a one-on-one peer support program for people with CF and their loved ones. And I've really enjoyed my time being a peer mentor in this program because I've been able to meet a variety of people. I started as a peer mentor in 2023, so I've been doing this for a little over 2 years now. And during my time in the program, I've been able to meet new mothers or parents with a baby with CF, young adults with CF starting college, as well as people with CF in their early 20s. This program also has a number of benefits. So again, just psychological benefits for both the mentor and mentee, being able to, meet more people with CF and find support in shared CF experiences. Also just that cross-learning and exchanging of helpful tips and information about managing CF. And at least in my experience, I've also been able to become friends with people in this Peer Connect program beyond the program itself. One example of this is I really like to write, and I was trying to write a stand-up comedy routine and was taking some CF experiences as inspiration. And one of the people that I'd been paired with, we had a very similar sense of humor, so I ended up sharing some of the jokes that I was trying to write with her, and it was just a really fun way to bond with her and get to laugh a little bit about our experiences managing CF. So finally, some recommendations based on all of these experiences that I've been a part of. So I think a lot of these recommendations I think are things that are probably either already being done or being discussed, but just kind of as a summary. So just continuing to build out more of these types of opportunities within care centers, within adult CF centers, within pediatric centers. I also think it would be interesting to try to cross-pollinate a little bit more between adult and pediatric centers and, create programs where adults with CF are paired with a child or with parents with CF, especially when someone is starting to transition from the pediatric center to adult center. And also just facilitating more cross-collaboration between CF centers, which I know already happens. And then I really love how the Peer Connect program matches mentors based on areas of expertise that they indicate that they have or experiences they indicate that they have. And so I think just building upon this and also matching people based on common interests outside of CF, and then also potentially on vocational or career interests. I think for me personally, CF had a really major impact on my career, and I actually got a lot of opportunities related to career opportunities because of my experience with CF. And so I think just, opening the door for more people with CF to get to take part in those kinds of experiences would be really helpful, especially as more and more people with CF are living well into adulthood. And then in addition, building more opportunities where you can create bridges from people who start as mentees can become mentors, I think is another really great way for just engaging more people and increasing involvement in the CF community. And then finally, I just wanted to give one last plug to the Singspire program. I think just building more programs like this that combat symptoms of CF through the art of singing. I believe that voice lessons are a form of both respiratory therapy and music therapy, as well as a form of mentorship. And I would even dream of a world where we could implement singing music therapy programs for people with CF and respiratory conditions at large that could even possibly be reimbursed by insurance. Thank you, and I'd love to answer any questions that you have.
So I actually have a question. This Inspire, is that something, and where do we find resources to give to our patients to be able to participate?
Yeah, so it's called breathebravely.com. I have a link in my presentation. I don't know if there's a way to share that with everyone. Oh, sorry, yeah, .org. breathebravely.org. So that's the link to the nonprofit, and then you can see more information about the Singspire program. And there's a like a application that you can fill out as a person with CF, so you can share that link with anyone with CF. Yeah.
Thank you.
Yeah. Thank you.
And our final speaker for today is Abraham, and he is a parent with a child with CF, and he is going to talk to us about his experience with mentorship. You didn't? No. Okay.
Good morning, everyone. Can you hear me? Okay. I want to begin by thanking to the people that give me the opportunity to be here with you today, all the representatives of the foundation, and especially my local Washington chapter. My name is Abraham Medrano. I've been living in the state of Washington for over 20 years, and I'm a proud father of 4 incredible children. In 2018, when we were expecting our 3rd child, everything seems normal, just like our previous pregnancies. But the night after our son Javier was born, something felt different. He wouldn't stop eating and crying. No amount of breast milk combined with formula could satisfy him. And we began noticing that his dirty diapers were more frequently. After the standard newborn screening, we were quickly referred to Seattle Children's Hospital. That's when we received the diagnosis. Our baby, just days old, had cystic fibrosis. As you can imagine, our shock and fear escalated quickly. Cystic fibrosis was something that we had never heard of. I'm born and raised in Mexico City, and my wife is a daughter of Mexican immigrants. Our roots are completely Hispanic, and we have never heard of anyone in our families having CF or even being carriers of the gene. We don't know what to expect or what does that mean for our son's future. Those medical appointments were incredibly difficult. Our fear was bigger than our understanding. And some of the things that we hear from the doctors, they don't make sense at the time. One phrase in particular stuck with me and take me years to really understand. You guys probably heard this one before, but it's what a wonderful time to born with cystic fibrosis. At those moments, those words were full of suffering and pain. It didn't bring any comfort. It just confuses and overwhelms us even more. But I remember something very clear that the medical team told us, and this was only trust the information you get from the Cystic Fibrosis website. We were full of fear with so many questions, but just 3 weeks after Javier's diagnosis, we were invited to attend an event called Parents Educational Day. It was intimidating walking in, not knowing what was expecting. We don't see any other Hispanic families or any other minorities there, but this was our first step into this amazing community. Back in 2018, resources in Spanish were a little bit limited. Our families had no idea what cystic fibrosis was. And we were trying to explain something that we don't even understand. The information was full of medical terms, pages and pages that overwhelm us. That's when we have to trust our care team and follow their guidance. After that first contact with the CF community, We want to learn more and get involved. But again, fear held us back. Fear of not speaking English fluently, at least on my side. You guys probably can see it right now. You guys kind of notice it right now. So the fear to not understanding everything, or just the fear of not fitting in. Then, months later, we found out that we were expecting again. Of course, we were scared, worried about the possibility of having another child with CF. But our fourth baby tested negative. Then came 2020. And like the rest of the world, the pandemic pushes into isolation. But that's when video calls, like Zoom, became more common. It was a small silver lining. We could connect with people from other states or other countries without leaving our home. By 2022, life was busier than ever. We have 4 kids. We're busy. Work, family, everything. But that's when the cystic fibrosis events started to become a bigger part of our lives. We noticed that more information became available in Spanish. We were finally able to better explain cystic fibrosis to our families. During one of these events, I heard about a program that truly changed the way I see things. That was Peer Connect. Peer Connect, it's a mentoring program for people living with CF and their families. A place to share experiences, fears, and doubts. As I learned more about it, I realized what an incredible tool it was. I could talk to people who were going through the same things I was. And most importantly, the language barrier was no longer a limitation. Spanish is my first language, and I feel most confident and secure speaking it. Knowing that there were other families out there just like us back in 2018, I know I need to be part of this, not just for my family, but I can share the knowledge with my community. I've been seeing firsthand how diversity with the foundation has improved in the recent years. It's more understanding, more effort, and more representation, especially among the staff and volunteers with Hispanic roots. But there's still a gap in understanding what a daily life is like in a community full of unique traditions and beliefs. And that's when Peer Connect makes a huge difference. This program gives me the tools to speak with others on my same situation. I became a mentor so I could share our experiences to help and be helped by other ones. It also pushed me to learn more about the latest research and resources so I can pass the knowledge along to the newly diagnosed families or those who haven't had the access to the information that they need. Beyond medication or treatments, we talk about real-world impact cystic fibrosis has on our lives. We share the challenges that came with the daily life, not just health-related, but cultural, emotional, and social. In our community, myths and traditions passed down through generations can affect how people understand cystic fibrosis. Having someone to talk who understands these things, it's a huge relief. Even just a few minutes over the phone or in a Zoom call can be life-changing. It reminds you that you're not alone, that some other one else faced something similar and they made it through. We've been fortunate to benefit from programs like Peer Connect and some other support networks. but also we feel the responsibility of give back, to be there for other ones. To all of you, the doctors, nurses, social workers, first of all, thank you. And all the care teams. You guys provide the tools and the knowledge that we need to live as normal as possible. But programs like Peer Connect bring something equally important. They bring understanding, human connections, and support. They give us the strength to keep going and to feel confident and live without a little less fear. Before I end, I just want to thank some of the people who made a real difference in our journey. Claudia and Jillian from the CF Peer Connect program. Christopher Mendoza, Director of Diversity and Inclusion on the Cystic Fibrosis Foundation. My amazing team on the Washington chapter, Tirsa, Erica, Tricia, Joanne, and Christy. A really special thank you to a person really important for us, Dr. Kogan. And those people that we've been having met along our journey, who became more than friends, they just became family. Thank you. I could be here without you support. And thank you all, you guys, for allowing me to share this little part of our lives. That's it. Sorry, I was really nervous.
So hopefully you guys have all enjoyed our education and mentorship updates. Any questions from the crowd for any of the speakers? And how?
For the Six Fire, is there an age that you can start to like log in for that? 'Cause I'm a pediatric center, so I have some younger girls that would love that particularly. So I just didn't know if there was a cutoff rate.
Yeah, I don't know that there's a set cutoff age at the on the bottom
Yeah,
end.
that's what I meant. Sorry, start. Yeah.
Yeah. I would guess maybe like 5 or 6 or something like that. Just being old enough to be able to just at least participate to an extent in some of the types of exercises they do.
Okay.
But I mean, Ashley is great. I feel like she accommodates anyone who's interested.
Awesome.
Yeah.
So for the parent and I don't want to call you the patient. The person living with sex. Yeah, thank you. There is a lot of information, and you guys have benefited greatly from your mentorship programs. As a pediatric provider, sorry, am I not loud enough? So I guess I'm wondering, are there certain points when you feel like it would be more helpful for us as clinicians to share with people with CF and their families these mentorship opportunities? Because sometimes I feel like the first visit is so overwhelming. Is that not the right time? Like, do you have a feel for when would be the best times? And then I think about transition to adulthood. There's so much we're trying to bring up to teenagers. And I'm just wondering the best kind of time points, or maybe even if you had thoughts on things that would trigger, if we heard from a person with CF or their family, a phrase like that would trigger the time to bring up mentoring.
Can you? Yeah. Okay. That's a really good question. I think it depends really on the person. I know that's not helpful. I think just always I think it's okay to bring it up initially, but not press it if it's not something that someone seems initially interested in, because it's a lot to process. But I think just having, the resources readily available, at all times is really helpful, because I think you never know when someone's going to, want to participate in something like that. But I also just probably, in terms of when it seems like someone would be interested, I think if just a patient or a parent expresses interest in CF more generally than maybe just their own personal experience, that would be what would maybe clue me into someone benefiting from, participating in a program like that. Yeah.
Okay. On my end, my input will be some of the parents that we've been meet in our journey, they have some kind of background or history with CF, and they kind of know what's going on. But it's the other side of the parents that they don't have any knowledge that they've been carrying the gene, and then they just get the diagnosis like us. And first, when we're pregnant, we're expecting a healthy baby. We don't know anything about it. Then we get the news, and it's shocking because you don't know what they're talking about. At that moment, you don't know if your baby is going to be fine. That's what I mean with my phrase, like, what a wonderful time to born with CF, because we don't know what CF was, you know. We are thinking, like, he has the worst disease in the world because that sounds complicated. So the first thing they told us is, don't look on YouTube because you're going to find weird things. So I think the focus in those kind of programs will be on those parents, the ones that they don't have idea what it is. It might be really beneficial connected with someone that it's been going through the same things. And our experience, the difference was that we're coming from Hispanic families, that they refuse to talk about that kind of stuff. But I think if you asked me back then in 2018, if we are open to talk to someone when we just get diagnosis, we probably will, just because we want to know what's going to be the future looks like. If back then in 2018 you told me that today my 7-year-old cystic fibrosis kid is being running around playing soccer like any other kid, I'll be really comfortable with the diagnosis. It's like, oh, okay, something else. Nothing's going to happen. But back then, I think the fear was that we don't have the information that a lot of the care centers provide, but we just probably scared of reach out for it. So the plan will be put the information on the table and try to make the parents take the best of it. Thank you. I hope that helps.
As someone who doesn't speak English as your first language, do you feel like Peer Connect really helped you to understand even like the therapies and cares for your child with CF? We have a patient whose family does not speak English, and I didn't know if that would be something that would be very beneficial for them just in understanding all of everything that CF encompasses.
Mm-hmm. Like I mentioned before, Peer Connect is a super powerful tool. But I think the biggest part of our treatments, it's being provided by our medical team. But Peer Connect was more for like a social life. As Hispanic families, we attend to don't share information, medical terminology. A lot of the parents or a lot of the families that are here in the States probably don't have the highest education, so some of those terms can be really complicated for them. So we try to kind of down the level on medical terms and explain things a little bit more understandable. I've been lucky enough that my wife is pushing me to talk about this kind of stuff, and I've been learning a little bit of the language. But I think Peer Connect is the tool that's going to give you the confidence of everything's going to be okay. The program is going to help that family to understand, don't worry about it. We go through what you're going right now. It's going to be fine. You just need to fully trust your medical team. And you guys, as a medical team, you guys have to kind of understand that people sometimes, maybe they don't even go to high school, middle school. A lot of people, they just came to work in the farms, in the fields, and they're scared about those kind of things because we have a lot of myths and health-related issues in Mexico. Like if your baby born with something like cystic fibrosis, it's because you probably did something wrong. You were doing something, or it's a weird way to think, seeing it from this side. But as people coming from another backgrounds that they have really, I don't want to say weird, but it's a lot of beliefs based in religion, pretty much. It's hard to make them understand on science. But that's where those programs are. Like, I'm coming from Mexico too. I probably even been in where you're coming from. I know your traditions over there. I know how you speak. I know how to talk about what's going on with your baby, and everything's going to be fine. I know you're going to have questions that once the baby is starting to go to school or daycares or things like that. And that's where we connect with families that we told them, like, pretty much everything's going to be okay. I hope that answered. Yes.
Sorry, I'll speak into the mic. So in San Diego, we have quite a population of Hispanics, mostly from Mexico, and very similar stories to yours, where their third or fourth child had cystic fibrosis, and the family had no idea what cystic fibrosis was or anything like that. And I do find that it's pretty difficult to get these families, some of our Hispanic families, to engage in things like Peer Connect or Education Day, from diagnosis time, even, when their kids are older and start to get sicker, and we're trying to engage them more. If there's a piece of advice you could give a care team to try to convince someone with, a different background, different set of beliefs to engage like you have, what would that advice be?
Ooh, that's a tough one.
I'm sorry.
Let's just say that right here we have the perfect combination. I like to talk, coming from Mexico City, but I don't share those things. My wife grew up here, and she's open to community, talk about the stuff, and she's the one that's been pushing me. But I think, again, like, Peer Connect is going to give you the tools that people needs to understand. It's hard to make someone understand, like, it's normal, it's fine, you're going to be fine. I laugh when they're saying 1 of 4 kids in the families have cystic fibrosis, because we have 4 kids and 1 has cystic fibrosis. But probably the best advice is just trying to slow down in the explanation. Don't overwhelm that people, and just pretty much, instead of, let's just say you have a program for a parents' educational day, and your way to present that program is like, oh, show up, we're going to talk about this topic, we're going to talk about this, and we're going to be doing these activities, it's just like as easy, like, come on, please come and join us so you can listen what's going on. Don't overwhelm people with a lot of medical terminologies or a lot of involvement. Like, don't try to get it at the first try. It's going to take a couple sessions to get it trying to participate in those kind of things. It's hard. I know it's hard. I personally been talking with families it's a first generation here, they have a baby, and the rest of the families, they don't even want to meet the baby because the baby has some kind of illness, or the baby's going to die pretty soon. I don't want to meet him because I don't want to get to loving him. Yeah, it's complicated to get those people involved. I know.
Thank you for trying to answer.
Yeah, it's a lot of cultural stuff, basically. That's why it's more easy for us talking with someone that's been going through those kind of things that grab a paper and read. It's a lot of information. It's a lot of terminology. It's a lot of misunderstanding too. Like, what does that mean when you're talking about genes or DNA? It's where a lot of the background or family myths about religion became, because it's like you're not playing to be Jesus here talking about genes. I think that's the biggest crash right there.
I can say that I'm part of Stanford Connect. I am a Spanish speaker, so something I want to do with families, it's easier to approach, hey, Claudia's here. Yes. I was hoping I was speaking loud enough. The phone kind of intimidates me. I want to make the program as approachable as I can. So sometimes it's easier for a Spanish speaker to say like, hey, let me get you connected with Claudia from the foundation. And that's a lot more approachable than like CF Peer Connect, which is, not very approachable. You can't really tell what the program's about. So if you have any Spanish speakers who you think that would benefit from the program, you can just like share my phone number or my email, and I can explain the program to them in a way that's relatable and understandable. You can always email peerconnect@cff.org to get in contact with me. And I'm also working to set up a Peer Connect phone number so that people can call, and it'll be in English and in Spanish. So instead of like filling out an intake form, they can just give this phone number a call and get them started on the process to get a mentor.
Exactly what she says. That's the perfect example. If you told me a couple years ago you want to be part of Peer Connect, no, I don't know what it is. Sounds intimidating. Why am I be connecting with someone? No, it's something intimidating. But if you told me, oh, let me give your phone number to Claudia, a real person, who's going to talk to you and explain you how you can connect or how you can talk to people that you're going to be able to speak in Spanish, and you're going to be able to share your experience, because the first couple times we have to open ourselves. Like, I'm Abraham, I have this kid, this is my situation, this is what I went through. And that's when the other people feel like, okay, I can trust you, and this is what I'm going through. But yes, it's even the name Peer Connect is like, whoa, I don't want to be part of something that sounds complicated.
I just want to add one thing to what Claudia said. On the app, there's a section called CFF Resource Board. And in there, you can download a flyer for Peer Connect in Spanish and also in English. And there's also another flyer on there called 2025 Community Grants, which includes Singspire. So if you want to have the resources on hand, those two you can download and have available.
Oh, hi, I'm Veronica Abraham's wife. I think just having that door open to the parents and just letting them know that that resource is available, and let them take the initiative to like when they want to do that. Just let them know it's available, they can do that, and have them reach out to them is a good way of putting it, because if you're just like telling them and telling them and telling them, I feel like sometimes that kind of intimidates a parent, that you're kind of like on that. But if you leave that door open and let them know that resource is available, is good from a parent's perspective.
Hi.
Hello, can you hear me? I'm Nicole. I'm a pulmonary PA at Utah, and I just had a question for Jasmine. I was wondering if you could share a little bit more about the LEAPP ACE and Forward program. Could you hear me?
Yes, you wanted to know more about the upcoming program. I unfortunately do not have any more information about that, but I can reshare that where they're going to be talking more about that. I don't know if we have an instructor from the LEAPP program here. I think she saw me look at her like, hey.
Yeah, I saw you look at me. Why don't you connect with me? Things aren't 100% formalized yet, but they're going to be coming formal. What I would say is make sure you're on the listserv. And those of you who aren't on the APP listserv or the nurse listserv or both, depending on your role, that's a great place to get information. Yeah, there is going to be more on, and Jasmine did share that slide with the other session for APP grand rounds. But yeah, things are getting reshaped, and they may be talking about this at APP grand rounds to try and allow for more accessibility more rapidly. The 2-year program was lovely, but it limited how many people could access it.
And it appears I have one more question online, and it's asking, are there resources only available to clinics and families? And I'm assuming that is from the Education Committee. That is a password protected mycff.org, so that is going to be for the clinicians that you can order or print out and share with your clinics and give to the families. There's resources for clinicians as well as to hand out to patients. And hopefully that answered your question. So the nurse mentorship, they actually there is mentorships for everybody. And if you get on your listservs, they will put out applications. The request is that to be a mentor, they want 5 years of experience, but mentees, it does not give a ceiling. But there's dietary, respiratory, physical therapy, pharmacy. So those are available to all types of practice, as well as the nurse coordinator. And sometimes if the clinic coordinator is not necessarily a respiratory therapist, they'll try and pair them together as the coordinator and the respiratory therapist, if that helps you. I was also a mentee, and it was quite helpful to see how another clinic works.
I just wanted to, since I didn't discuss how the program worked too much, so make sure you're on your listserv because you will receive those applications. And then you pretty much just get paired up as long as there's a mentor and a mentee that match close enough. Like I said, I don't match, like Rady's doesn't match super closely with Utah, but it was still a really great experience. So there's an application process, and then you have someone who guides you through the entire thing, setting up from travel to the things you need to do as a mentee prior, as well as I'm sure a mentor prior. I have not had that opportunity yet to be a mentor, but so just make sure you're on your listservs and all the information. It's a pretty easy process, and they guide you through the whole thing. And that's all I wanted to add about that.
I also, as well, was a mentee, and I had a really good experience. I went to an actual smaller center from Pittsburgh. We have quite a large center, and I went to New York, and it was a bit smaller and run slightly different, but it was helpful to get how things work and how she organized everything to keep everything together. So.
I think also when I did the coordinator mentorship, I had a couple years of experience, and I want to say there was a limitation on that, but I did explain that I was coming into that role. We're a very small CF center. I think at the time there was maybe 3 of us for our care team, so I really didn't have anyone else to mentor me except for the director, and so I really highlighted that in my application of why I was looking for that, and that we were a small CF center because the person reviewing the applications may not know your situation. So I think it's really important to highlight why you're wanting to do this, even if you do have more experience than maybe what some of the limitations are stating.
And I would just add, put a plug in, it makes a great connection that you have somebody else to bounce something off of if you have a question, and you can build lifelong friendships within the CF program. It's really nice. Okay, it looks like that's all the questions we have. I can double check one more online. So we're finishing up a little early for everyone. So some coffee, some food, travel to your next. Thank you.